As diabetes silently affects millions around the world, it often leaves clues, not just during the day, but also in the quiet hours of the night. While many of us recognize signs like thirst and fatigue during the day, nighttime symptoms are often overlooked, slipping by unnoticed. These nighttime signs may seem small, but they can reveal a lot about blood sugar imbalances. And if left unaddressed, they can lead to serious complications over time. In this video, we'll explore the most common nighttime symptoms linked to diabetes and why recognizing them can make a huge difference in managing this condition effectively. Frequent urination, nocturia. One of the earliest signs of diabetes is frequent urination at night, known as nocturia. As blood sugar levels rise, the kidneys work harder to remove the excess glucose from the body, leading to increased urination. While many people might dismiss it as a normal part of aging or the result of drinking water before bed, frequent urination at night could be a sign of uncontrolled blood sugar levels. Frequent disruptions in sleep due to bathroom visits can impact the body in multiple ways. Poor quality sleep can exacerbate diabetes symptoms, weaken the immune system, and lead to irritability and fatigue during the day. Intense thirst, polydipsia. Linked closely to frequent urination is the issue of intense thirst, or polydipsia. When blood sugar levels are high, it can dehydrate the body, causing the brain to signal the need for water. People with diabetes may find themselves waking up in the middle of the night with a dry mouth, feeling the need to drink water. However, this can create a cycle where drinking more water leads to increased urination, further disrupting sleep. Chronic thirst, especially if experienced alongside frequent nighttime urination, can signal that blood glucose levels are not being adequately managed. This is a key reason why polydipsia should not be ignored: night sweats. Night sweats are another symptom often linked to diabetes, though people may assume they result from unrelated factors, such as temperature or stress. Blood sugar fluctuations, especially a drop in blood sugar levels, hypoglycemia, during sleep, can trigger intense sweating. Hypoglycemia often happens in those who take medications for diabetes, such as insulin or sulfonylureas, which lower blood sugar levels. Sweating at night may seem harmless but persistent. Unexplained sweating that leaves sheets or clothing soaked can indicate a blood sugar imbalance. People who experience night sweats regularly should consider tracking their blood glucose levels and discussing this with a healthcare provider. Restlessness and insomnia. Low blood sugar can create physical discomfort and a sense of anxiety, which leads to restless sleep. During a hypoglycemic episode, the body releases stress hormones, like adrenaline, in response to low glucose levels, leading to insomnia and disrupted sleep cycles. This symptom may lead people to awaken suddenly during the night or have difficulty falling back asleep. The stress response to low blood sugar can cause sweating, palpitations, and feelings of nervousness, making it challenging for people to achieve restful sleep. Chronic insomnia, if ignored, can worsen diabetes by increasing stress levels and further destabilizing blood sugar. Frequent nightmares. Nightmares, especially vivid or distressing ones, can be an indicator of low blood sugar during sleep. Hypoglycemia can interfere with brain function, which may prompt strange or frightening dreams. These episodes are more common for people who take insulin or medications that lower blood sugar, as glucose levels tend to drop naturally during sleep, potentially to dangerously low levels. Experiencing nightmares occasionally is normal, but if they occur frequently, it could suggest underlying blood sugar issues. Persistent nightmares combined with other nighttime symptoms warrant checking blood sugar levels regularly, especially before bedtime. Leg cramps and pain. Many people with diabetes suffer from peripheral neuropathy, a form of nerve damage that can cause pain and cramping in the legs. This pain tends to intensify at night when the body is at rest. People often describe this sensation as a burning, tingling, or stabbing pain in their legs and feet, which can disrupt sleep. Ignoring nerve pain can have long-term consequences. Neuropathy is a progressive condition that, if untreated, may lead to severe complications, including numbness, increased risk of injuries, and even amputations. For those with diabetes or prediabetes, experiencing regular nighttime cramps and pain should prompt a visit to a healthcare provider to evaluate nerve health. Fatigue in the morning. Poor quality sleep due to the above symptoms can result in waking up feeling fatigued and unrested. While everyone feels tired from time to time, regular morning fatigue that doesn't improve with adequate rest is a red flag. This fatigue might not be easily attributed to diabetes by many, but it could signify uncontrolled blood sugar. For those with diabetes, morning fatigue is particularly concerning because it can lead to insulin resistance and blood sugar spikes. In addition to tracking blood sugar levels, improving sleep hygiene and managing stress can help alleviate fatigue. Ignoring the nighttime symptoms of diabetes can result in a cycle of deteriorating health, with consequences that extend beyond a few disrupted nights. High blood sugar levels over prolonged periods can damage vital organs, including the heart, kidneys, and eyes, increasing the risk of serious complications such as cardiovascular disease, kidney failure, and vision loss. Understanding these symptoms empowers individuals to take control of their health early on, seeking medical intervention before the situation escalates. Nighttime signs are the body's way of signaling that something isn't right with blood glucose levels, so recognizing and addressing them could prevent more severe health issues in the future. Recognizing these nighttime symptoms as potential red flags is the first step toward better health. By taking timely action, monitoring blood sugar levels, and seeking the right medical guidance, you can gain more control over diabetes, reduce nighttime discomfort, and improve your overall well-being. Remember, small changes can make a big difference. Listen to your body, act early, and take the steps that will help you rest easier each night. Thank you for watching. Don't forget to like, subscribe, and share this video to help others learn more about managing diabetes effectively.